Okay, good morning, Miss. So, first, can I know your name?
Amira,
Amira. So, Miss Amira, how old are you?
20 years old.
Do you work?
No, I'm studying.
Are you married?
No.
No. Okay, Miss Amira, can you tell me where did you feel pain and did you feel any stiffness, weakness, or loss of function?
My foot feel pain and stiffness. I feel difficult to go to the toilet.
Okay, so, where did you feel pain and symptom first? Can you explain to me?
Last week I go for a jog, then suddenly I trip and falls on the track. My right foot suddenly feel pain, then I stop and sit. So at home my foot getting swollen. I applied ice and rest. During the night the pain become worse. So the next morning I went to the clinic and the doctor suspect of fracture and asked me to go to the hospital immediately.
Okay, Miss Amira, how do you feel today? Did the symptom getting worse this morning?
Yes, today the symptom getting worse and I feel pain when walking for too long. I can't drive to go to the hospital today.
Okay. So can I know from the pain scale here? Um, so can I know from the pain scale here? Um, from 0 to 10, can you tell me how did you feel today, this morning?
This morning 6, during the night 9, right now 8.
Okay. Okay, Miss Amira, do you have any difficulty to sleep?
Yes.
Yes. So can I see where the area did you feel pain?
Yes, sure.
Okay. Okay, Miss Amira, did you feel an increase of pain when you do any daily activity like cooking?
Yes, I feel pain when cooking for too long.
So, what did you do to reduce the pain?
I will just take a rest for a few minutes.
Okay. Okay. In 24 hours, in the morning, does the pain getting worse or better?
In the morning, the pain is still okay.
So during the night,
The pain is getting worse.
do you have to take any medication to get to sleep?
No.
No. Okay, Miss Mira, does the pain increase very quickly and takes a longer time to settle back?
Yes.
Do you have any medical problems?
No.
Do you have any family members with diabetic or any disease?
No.
Okay, Miss Amira, do you have any surgery before?
No.
What types of house do you live?
Double-story house.
Do you currently take any medication?
No.
So that's all. Thank you. Okay, Miss, now can you try to walk? Okay, now Miss, can you move from sitting position to standing position? Okay. Okay, now Miss, I'm going to check for your painful area, okay? Okay, now Miss, I'm going to palpate your right foot. So if you feel any pain, please let me know, okay? Miss, now I'm going to do the sensation test for your skin, to test your skin. Okay, this is cool water and hot water. Now, first I'm going to test your skin with your eyes open, okay? Okay, so this is cool, this is hot. Okay, now can you close your eyes and tell me which one is cool and hot, okay? Okay. Cool, hot, cool, hot. Okay, now I'm going to do the special test, which is the anterior drawer test. So the purpose for this test is to test the ligamentous laxity or instability of the ankle. So first, put put your hand at the patient distal foot, distal leg with one hand for stabilize, and then put your other hand at the calcaneus bone and do the let the patient do the plantar flexion for 10 to 15 degrees, and then translate the patient anterior foot forward. So the patient will the result will be positive if the patient feel pain. Okay, Miss. Now I'm going to measure the range of motion of your ankle joint. Okay. So first make sure that the patient in sitting position. Okay, I'm going to measure the right foot first, and then repeat to the other side, and then compare the result. Okay, now I'm going to do the dorsiflexion. So the range of the normal range for dorsiflexion is 0 to 20 degrees. Okay, now Miss, can you lift your foot up as much as you can? Some more. Okay. Okay, now I'm going to push some more, and if you feel any pain, please let me know. Okay. Okay. So the active range of motion for this patient is 0 to 10 degrees, and the passive range of motion 10 to 20 degrees. Okay, now I'm going to test for plantar flexion. Okay, Miss. Now can you move your foot downward as much as you can? Okay. Some more. Okay, now I'm going to push some more. Okay. If you feel anything, please let me know. Okay. So the active range of motion will be 0 to 20, and then the passive range of motion will be from 20 to 45. Okay, now I'm going to test for the eversion. Okay, Miss, can you move your foot outward? Okay, some more. Out. Okay. Now I'm going to push some more, and if you feel anything, please let me know. Okay. Out. So the active range of motion will be from 0 to 10, and the passive range of motion will be from 10 to 15 degrees. Okay, now I'm going to measure the range of motion for the inversion. Okay, Miss, now can you move your leg inward as much as you can? Okay. Out. Okay, now I'm going to push some more. Okay, if you feel anything, please let me know. Out. Okay, so the active range of motion will be from 0 to 10, and the passive range of motion will be from 10 to 30. Now, Miss, I'm going to do the manual muscle testing, which is to test your muscle power. Okay. So first I'm going to test the right foot, and then repeat the same step to the other foot, and then compare the result. Okay, Miss, now I'm going to do the for dorsiflexion. Okay. Okay, first I'm going to start with grade 3, which is full range of motion against gravity. So now, Miss, can you move your foot up as much as you Okay, now I will proceed with grade 4, which is full range of motions against gravity with added minimal resistance. Okay, Miss, now I'm going to apply some resistance, and then please move your foot upward against my hand. Okay. Some more. Okay. So the grade will be grade 3, which is full range of motion without any resistance. Okay, now I'm going to test for the plantar flexion. Okay, Miss, can you move your foot up as much as you can? Okay. Okay, now I will proceed with grade 4. So now please move your foot up against my hand. Okay, if you feel any pain, please let me know. As much as out. Okay. So the patient for plantar flexion will be grade 3, which is full range of motion against gravity, but without any resistance. So and then now you can repeat with the other side and then compare the result. Okay, now I'm going to do for inversion. Okay, Miss, can you move your foot inward as much as you can? Okay, now I'm going to apply some resistance, which is to increase the grade to grade 4, and please move your foot inward as much as you can against my hand. Okay, if you feel any pain, please let me know. Okay, move some more. Okay, so the patient inversion will be grade 3, which is full range of motion against gravity without any resistance. Okay, now I'm going to test for inversion. So, Miss, can you move your foot outward as much as you can? Okay, now, Miss, I'm going to apply some resistance. Please move your foot outward against my hand. Okay, if you feel any pain, please let me know. Okay, so the patient for inversion will be grade 3, which is full range of motion against gravity without any resistance. Okay, now I'm going to take the limb girth measurement for the calf muscles. Okay, make sure that the patient is supine lying, and first measure the right side and then repeat to the left foot. Take the measurement at the cross section. Okay, now I'm going to take the limb length measurement. Make sure that the patient in supine position, and then there's two type of measurement, which is true measurement, which is from the axis to the medial malleolus, and then the apparent measurement, which is from the umbilicus to the medial malleolus. Okay, first I'm going to measure the right side and then repeat to the other side and compare the result. Now I'm going to take the true measurement, which is from the axis to the medial malleolus. I'm going to take the apparent measurement, which is from the umbilicus to the medial malleolus. For the first treatment, I'm going to apply ice pack on the patient foot. So before we proceed with the treatment, please check for any contraindication at the patient's skin. And first, I'm going to do the skin sensation test. Okay, Miss. So I'm going to do the skin sensation test to test your skin. So this is cold water. This is hot water. Okay. So now can you close your eyes? Okay, now before you apply the ice pack, please make sure to put a thin towel at the patient foot. Okay, make sure to cover the ice pack with a thin towel to avoid the patient's skin from burning. Okay. Now leave for about 10 to 15 minutes. After you take off the ice pack, please make sure to check the patient's skin. So if there's a little redness, it's a normal reaction after apply the ice pack. So you can ask the patient to do this for about 2 to 3 times per day. Okay, now I'm going to ask the patient to do the active joint mobilization exercise. So, Miss, can you move your foot upward and downward and repeat this exercise for 30 repetitions, and you can do this for 3 sets for each leg, and do this in the morning, in the afternoon, and in the evening. Okay? So, can you do upward, downward for 30 repetitions? So if you feel any pain, please stop this exercise immediately and take a rest in between. Okay? Okay, now I'm going to do the towel scrunches exercise for gaining strength. So first you can put a towel at the floor and then put a wig or a cup on the towel, and then ask the patient to bring the cup closer to her, and by doing the toes flexion. So you can ask the patient to do this for about 15 repetitions, and do 3 sets for each leg, and then you can ask the patient to do this in the morning, in the afternoon, and in the evening. So Miss, can you move the cup closer to you by doing the toes flexion? In the next visit, I will check for your progression, and I will add some more exercises to increase your progression. Okay, so that's all. Thank you.